Welcome to Spot Podcast, the voice of scientists, where groundbreaking research meets your ears. We bring you the world's top-cited research articles in an engaging podcast format, making cutting-edge science accessible anytime, anywhere. Stay informed, stay inspired. This is the Spot Podcast, the voice of scientists.
All right, we're diving deep into liquid biopsies today.
Less needles, more insight, right?
Exactly. Think cutting-edge science, all thanks to
A pretty comprehensive review in the Journal of Hematology and Oncology.
Yeah, we've got excerpts from that, and by the end, you'll understand how these liquid biopsies could change.
I mean, really change how we diagnose, treat, and even screen for cancer.
So before we get ahead of ourselves, what exactly are liquid biopsies? I know it involves blood, but...
Yeah, but what are they actually looking for in there?
Exactly.
Well, it's like a detective story, but it's playing out in your bloodstream.
Ooh, I like that.
Liquid biopsies analyze stuff in your blood that comes straight from the tumor.
Stuff like...
We're talking actual circulating tumor cells, or CTCs.
Oh, wow.
Those have broken away from the main tumor.
And are just floating around.
And also circulating tumor DNA, or ctDNA, which are like little pieces of the tumor's DNA.
So they capture these CTCs, analyze the ctDNA...
And scientists can peek into the tumor's secrets.
without a tissue biopsy.
Exactly. And because it's way less invasive than a tissue biopsy, it opens up a ton of possibilities for keeping tabs on the cancer.
Oh, that makes sense. But how do they actually find these teeny clues in the blood? It's got to be like
A
finding...
needle in a haystack.
Yeah, exactly.
That's where the fancy equipment comes in.
Makes sense.
There are a bunch of different methods for isolating and analyzing that ctDNA.
Oh, okay.
Some are like ultra-sensitive metal detectors. They can
Oh.
pick up even the faintest trace of mutated DNA.
Picking up the...
Tiniest signals.
Got it.
While others are more like...
Okay.
Like they're making a custom fingerprint for each patient's cancer.
Oh, that's fascinating. So depending on what info they need
Scientists can use different techniques, yeah.
to get the most accurate and detailed image.
Picture of the tumor, yep.
But wait, you mentioned CTCs too.
Oh, right.
How do they even isolate those?
Well, there are a few ways.
Okay.
Imagine using these specialized antibodies, they're like fish hooks,
Oh, cool.
to fish out those CTCs based on their unique surface markers.
I see.
Or think of it like
Okay.
sifting through a pile of rocks to find the biggest ones.
Interesting.
They separate the CTCs just based on their size.
So it's all about
different techniques, yeah.
each
different
strengths and weaknesses.
Got it. So once they snag these CTCs, what can they actually do with them?
We can analyze their DNA, RNA, protein content, the whole shebang.
Really?
Oh, yeah. We can even culture them.
Culture them.
Grow them in a lab.
Hold on. You can grow mini tumors from those circulating cells.
Yep. It's pretty amazing what science can do.
That is wild.
But what's really cool is how this all translates into actually nuking patients.
Okay, let's get to the good stuff then. The clinical applications.
Yeah.
How are liquid biopsies actually being used to benefit patients right now?
They're being used in so many ways.
Like what?
Well, for example, they can help predict how a patient might respond to immunotherapy,
Oh, cool.
which is, a treatment that helps the immune system fight the cancer. Right.
By analyzing that ctDNA and the CTCs,
Doctors can.
get a sense of whether the treatment's working
Yeah.
or if the tumor's becoming resistant.
So it's like an early warning system.
Yeah, exactly.
That's incredible. I imagine it's not just immunotherapy
You're right.
that it's useful for.
It's not just limited to that, no.
What else can it do?
Liquid biopsies can also predict response and resistance to targeted therapy and chemo.
Oh, wow.
And they can give us prognostic information, which means
Okay.
giving doctors an idea of how the cancer is likely to behave
Gotcha.
and how the patient might do over time.
So it's not just about finding the cancer.
Right.
It's about,
It's about understanding it,
yeah,
predicting its course, and picking the best treatment strategy.
very cool.
And one of the most exciting parts of liquid biopsies is their ability to assess what we call tumor heterogeneity.
Okay, now remind me what tumor heterogeneity is again.
You got it.
I always forget.
Think of a tumor as a diverse community of cancer cells. Not all of them are the same. They can have different genetic mutations, different behaviors,
Got it.
and they can even have different responses to treatment.
Oh, wow.
And liquid biopsies can capture this diversity.
I see.
They provide a more complete picture of the cancer's genetic landscape.
So by analyzing the ctDNA and CTCs from different parts of the tumor, doctors can really get a good understanding
Of the enemy, so to speak.
Yeah, that's a great way to put it.
And with this info, they can identify what we call actionable alterations.
Actionable alterations.
Which are specific mutations that we can actually target with the right therapies.
So it's like a personalized map of the cancer's weaknesses.
Exactly.
That's amazing.
And sometimes liquid biopsies can even help identify these actionable alterations when we don't even know where the primary tumor is.
Really?
Yeah.
So when doctors don't know where the cancer started,
Mm-hmm.
liquid biopsies can give them clues.
Exactly.
Wow.
Another advantage is they can help patients who can't get a tissue biopsy,
Oh, right.
whether it's too risky or just not possible.
So for those patients, liquid biopsies offer a safe way.
Yeah, a safe and effective way to get that crucial molecular information.
Gotcha.
And then there's the potential for early cancer detection.
Now that's what I'm talking about.
Right.
Imagine just a simple blood test that could...
Catch cancer before symptoms even show up.
Yeah, exactly.
We're not quite there yet.
Okay.
But there has been some really promising developments.
Like what?
Well, for instance, cfDNA analysis, which is used for prenatal testing,
Yeah?
has actually led to accidentally finding early-stage cancers in some pregnant women.
Really? So a test designed for one thing.
Ended up uncovering cancer
That's exciting.
at its earliest stage.
So what other approaches are they using for early detection with liquid biopsies?
Well, scientists are looking at things like extracellular vesicles.
Extracellular vets.
They're tiny packages released by cells,
Oh, okay.
including cancer cells, and they can carry tumor DNA and RNA.
I see.
And they're also investigating DNA methylation patterns.
DNA methylation pattern.
Yeah, those are chemical modifications to DNA that can be different in cancer cells.
So they're searching for any little changes in the blood that might...
Hint at a tumor developing.
Yeah. How, sir?
And there are even more applications for liquid biopsies.
Oh, wow.
They're also being used to monitor patients who are going through CAR-T therapy.
CAR-cell therapy.
Right.
Right.
Which is a super cutting-edge treatment that uses genetically engineered immune cells to attack the cancer.
That's amazing.
And liquid biopsies can help predict if those CAR cells are doing their job
Right.
or if there's a chance of the cancer coming back.
Gotcha.
And they can do even more than that.
Oh, really?
Have you heard of cfDNA fragmentation?
cfDNA fragmentation. No.
It's a really fascinating area of research.
Okay.
By looking at the patterns of how the cfDNA breaks down,
Okay.
scientists can get clues about where the cancer came from
Oh.
and how it's behaving.
So the way it's fragmented can tell us something?
Yeah,
That's wild.
it has the potential to really change how we diagnose and treat cancer.
This all sounds fantastic, but I'm sure there are some limitations, right?
Of course.
What's the catch?
Well, one thing is, not all patients have detectable amounts of ctDNA or cfDNA in their blood,
Oh, right.
especially those with early-stage cancers.
So a negative result doesn't necessarily mean you're cancer-free.
Exactly.
Okay.
Another challenge is that there are tons of different methods and platforms for doing liquid biopsies,
Yeah, I can see that.
and we still need to standardize them across labs.
So the results could vary depending on where the test is done?
That's right.
Gotcha.
What else? Well, there's something called CHIP,
Chip?
which refers to mutations that happen in our blood cells as we age.
Okay.
And these can sometimes be mistaken for cancer-related mutations in a liquid biopsy,
Oh, no.
especially in older folks.
So that's like a false alarm.
Yeah, it can.
That's not good.
And lastly, it's important to remember that even though liquid biopsies can give us a wider view of the tumor
Right?
than a tissue biopsy, it's still not a complete picture.
So there's still more to learn.
Always.
But it sounds like liquid biopsies are really revolutionizing how we treat cancer.
They really are.
They're giving us a less invasive and more informative way to deal with this disease.
I completely agree. It's a game changer. And the future of liquid biopsies is really bright.
Awesome. Okay, listeners, we've covered a lot of ground today in this deep dive into liquid biopsies.
We have.
We've gone over the basics, the science behind it, and some of the exciting ways it's being used to improve cancer care.
It's really incredible.
It is. We've been talking about blood, but it turns out
There's a whole other world.
a whole other world of fluids
Yeah.
that can give us clues about cancer.
It's like having multiple informants, each with a different piece of the puzzle.
Ooh, I like that analogy.
We're not just limited to blood when it comes to liquid biopsies.
Oh, really?
We can analyze other bodily fluids,
Like what?
like urine, spinal fluid, even the fluid that builds up around the lungs or in the abdomen.
So it's like expanding the search
Expanding the investigation
beyond the blow.
to get even more info.
I see. And each fluid can give us...
Unique insights.
It's like
yeah.
what? Give me an example.
Okay, well, urine has actually shown some promise for monitoring response to certain targeted therapies
Really?
in lung cancer.
So you can actually tell how well a treatment's working
Sometimes, yeah.
just by analyzing someone's pee.
Well, studies have shown that an early spike in tumor DNA levels in the urine can be a good sign
Really?
because it suggests the treatment's actually killing cancer cells, making them release their DNA.
So it's like a temporary surge of tumor DNA when the
It
treatment...
starts working.
That's incredible. Okay, what about spinal fluid?
Oh, yeah.
I know that's often used to...
Diagnose and monitor conditions affecting the brain and spinal cord.
Right.
But it can also be really useful for detecting cancers that have spread to the central nervous system.
Okay.
For example, in some lymphoma patients,
Okay.
Finding tumor DNA in their spinal fluid
Yeah.
has been shown to be a strong predictor of relapse in the brain,
So they can get an early warning.
that the cancer might be coming back.
Wow, that's
And that lets them start treatment earlier to the brain.
exactly makes sense. Now, you also mentioned fluids that build up around the lungs
Uh-huh.
or in the abdomen?
Yes, those are called pleural effusions and ascites.
Okay.
And they can be really helpful for liquid biopsy analysis.
Why is that?
Well, because the concentration of tumor DNA in those fluids can
Yeah.
actually be higher than in the blood.
So it's like a better source.
A richer source of tumor DNA, yeah.
Wow, it's amazing that we can get so much information from all these different fluids.
It is
It's like this multi-pronged attack
a multi-pronged
on
approach.
understanding and managing cancer.
And as research continues, we're likely to find even more ways to use them to help patients.
That's great. I have to admit, though, with all this talk about different fluids,
It is a lot.
complex analysis, I'm starting to feel a little
Overwhelmed.
overwhelmed.
It's understandable.
It's a lot to take in.
It is a complex topic.
But I guess the key takeaway is,
That liquid biopsies are really changing cancer care.
right,
They're giving us a less invasive, more informative way to approach this disease,
and it's all about
empowering patients and doctors with more knowledge.
more knowledge, more options.
Exactly.
And I'm sure as we continue to explore the potential of liquid biopsies, we're going to see even more
Transformative advancements. Oh,
in
yeah.
the years to come.
Definitely.
So excited about it. Okay, listeners, we've explored the different types of liquid biopsies,
We have
the science behind them, and some of the exciting possibilities they offer.
some really cool stuff.
We've even gone beyond blood to discover how other bodily fluids can help us understand cancer.
Like, who knew your pee could tell you so much, right?
Right, okay. With all this science and technology talk,
Yeah,
it's easy to forget that liquid biopsies are really about people.
that's so true.
What does all this mean for someone actually going through cancer?
Liquid biopsies are about, improving lives, not just lab results.
Right.
Think about the emotional toll of a cancer diagnosis.
Oh, absolutely.
It's already overwhelming, and then you're told you need a tissue biopsy.
It's scary.
Yeah, it can add so much stress and anxiety on top of everything else.
For sure.
Because tissue biopsies can be painful, invasive, sometimes even risky.
Right.
But with a liquid biopsy, it's often just a blood draw.
Yeah.
That can make a huge difference for someone already dealing with a tough diagnosis.
Like taking some of the fear out of it.
Yeah, exactly.
And it's not just the initial diagnosis either.
Right.
Liquid biopsies can also change what it's like to go through treatment.
For sure.
Imagine going through chemo,
Uh-huh.
waiting for those scans to see if it's working.
Ah, it's agonizing.
It's like you're in limbo, not knowing what's happening inside.
Totally.
But with liquid biopsies, we can check the response way more often.
And with way less hassle for the patient, too.
Yeah.
A simple blood test can tell us if we're on the right track or if we need to switch things up.
So it's like a real-time feedback loop,
Exactly.
guiding the treatment in a more personalized way.
And that can be really empowering for patients.
Absolutely.
They're not just sitting there, they're actually involved.
Gives them some control when so much feels out of control.
Exactly.
And then there's the possibility of early detection,
Don't even get me started.
which could totally change survival rates.
It could be huge.
Just imagine a routine blood test could catch cancer super early.
When it's easiest to treat,
That's the dream.
it is, and liquid biopsies are leading the way there.
It's amazing how far we've come.
And there's so much potential.
Liquid biopsies are more than just like a new technology. It feels like they're changing how we even think about cancer care.
I completely agree, giving us a much deeper understanding and more ways to fight it.
Well said. So, to all our listeners out there, I hope this deep dive into liquid biopsies has been helpful
I hope so, too.
and maybe even a little inspiring.
It's such an exciting field.
It really is, and it has the potential to make a real difference in people's lives.
Absolutely. And as the technology keeps getting better, who knows what incredible breakthroughs are coming next.
It's definitely something to be hopeful about. Thanks for joining us on this deep dive, everyone.
Thanks for listening.
Until next time, stay curious, stay informed, and most importantly, stay hopeful.
Stay curious, keep exploring, and join us next time for more groundbreaking research brought straight to your ears. Don't forget to subscribe and share, because science is meant to be heard.